The way you dress, the way you enter the chamber or the room, do you have any tips for that?
Oh, absolutely. So, Dr. Shenvi, I'm going to tell you something that how I drove myself crazy trying to prepare for dental school interviews. And the reason for that is I had no idea what to do, how to do. So I looked up online for multiple hours, reading articles, videos on how to dress up, what are the body language signs, what is the psychology behind each question. So I think so. I went too far deep trying to find answers for this, which was not really required. But I'm going to share some few tips to the students regarding dressing for interviews. So there's always a phrase that is used. I'm going to repeat this line. There's always a phrase that is used: "Dress to impress." You know, so you always wear formal shoes, tie, get a tailored suit for an interview. Versus there are some people who will just come with a shirt and a tie, versus some people who come wearing a suit, jacket. It doesn't have to be a three-piece suit, but at least a nice jacket, well matched pants, well dressed shoes, because it gives me an impression that you take this job or an interview seriously. A tie is a must. The second thing is if you have a beard, it has to be well trimmed. If you are a clean shave, make sure you shave. Third thing, this may sound really ridiculous, but do not use overtly strong perfumes, and this may apply men in terms of cologne or women in terms of perfumes, because nobody wants to sit in a room where it be too much of a perfume. A little bit perfume is okay, but it doesn't have to be overtly strong. Your health should be well kept. You should look like a thorough professional. Now, when you enter the room, there are two critical things when I look forward to, and any interviewer look forward to, is the way you make an eye contact and the way you shake your hands. So you have to look at the interviewer in their eyes, make a firm handshake, and greet them. If it's a good morning, good afternoon, and just say, "Hello, how are you doing?" These things are very important. When you're trying to answer a question, you may be nervous. You can always say, "Oh, oh, that's a good question," and have that little time to think before you answer. A lot of people think the moment a question is asked, you have to answer immediately. No, that is not true. Think your time, think about the question, and then answer it. You're not going to get any extra credits for answering the question right away. It has to be a well thought answer. But again, how does your confidence come from? You're looking straight to the interviewer in their eyes. You're confident in your answer. And the most important tip is to speak slowly. Somehow in India, we are used to speaking really fast, and sometimes some words get lost in translation. So it is very important to take your time pronouncing your words. It doesn't have to be perfect English. They understand you're an international student, but don't run as if you're running a bullet train when you're answering a question. Take your time to answer a question. But again, three critical things: a well dressed person or a candidate, a firm handshake, and a good eye contact. Three very critical things that are important when a candidate enters an interview room.
There are times where people have told me that questions like, where do you see yourself after 5 years, 10 years? Such kind of questions are asked. If somebody asks me at a age of 24, 25, I really don't know. Maybe I can, at that time, I might have think that I know what will happen 5 years, 10 years down the lane. But today, if you ask me, I really don't know what will happen after 5 years or 10 years down the lane. But yeah, I can really have a vision that where I want to reach. At this age, it is easier for me. Like, yeah, I want to. When I started this YouTube channel, when I came from US, I was very clear that I came across this channel called as Khan Academy, where the things were made so simple. And when I'm teaching in the my institute, I feel things are made so complicated. You have to give a topic lecture for 1 hour, 2 hour, where you can just finish it in 15 minutes. So now I have an ability. I'm sure some of the youngsters also will have it. But what was your answer when, I'm not sure whether they have asked you this question, but if what was your answer, or what are the things students can consider to answer such difficult questions?
Again, the question about when a faculty asks you what is your goal in terms of 5 year goal or 10-year goal, these are usually the questions that are also asked in interviews, even at a job interview. They're basically trying to get an idea of where do yourself, where do you see yourself after dental school? What are you something that you're passionate about? Are you willing to go into residency, or are you going to just go into private practice? What are the ways you would want to contribute back to the community? The way I answered my question was I divided this question into two parts. I told them about what my short term goal was, and I told them about my long term goal in terms of 5 years and 10 years. So I usually answered saying that my short term goal is to get admission into a dental school and enhance my knowledge from where I was today to where I want to become in the future. Also, I answered it is my passion to pursue education in endodontics because I have been shadowing my mentor, Dr. Taylor, for 3 years. And that is something that I'm very passionate about. On graduation from dental school, I see myself becoming a faculty at a dental school because I believe education is a lifelong process. I believe that I have great communication skills and I want to use these skills for the benefit of the next generation. And that is one of the reasons I want to become a teacher. Equally important is to use my skills for the benefit of patients. And that is the reason I also want to go into private practice. Besides work, I would also like to contribute to the community by participating in events like Give Kids a Smile or volunteer at some organizations that provide free dental schools, because these are the things that gives me to explore dentistry beyond the four walls of my clinic or dental school. I also want to make sure that I do things where I'm able to give it back to the community in some form or the other. So that was my answer. And I also usually quoted my grandfather about, long time learning after education is over. My grandfather used to always say that once a student, always a student. So I used to always say that besides dental school, my education doesn't stop there. I also want to be involved in attending different CEs or courses or conferences to enhance my knowledge, because dentistry is growing like every other profession, and we have to keep updated with the latest trends in technology, research, and advancements to make ourselves a better provider.
Very true. That's a very nice answer, which I'm sure the teachers liked. One another question which people often mention is they do ask you how do you handle stress, or what are your hobbies. I'm very keen on knowing how will you answer this, and what is your hobby, in general, which help you to overcome the stress what you may have during your work.
Absolutely. So this question is very critical because a lot of emphasis is paid on generic answers that the students want to give, that, oh, I do yoga, because they think that, oh, I do meditation, mm, because they think that it's more appealing. But I think it is very important to be honest about this answer. And you also have to understand why is this question being asked. So the first important thing is dentistry is a high stress profession. Life in a dental school is full of stress. They want to know how you can handle the stress in the dental school so that you can successfully complete the DMD or the DDS program. So the way I answered was I talked about, I agree that we all have stress in different forms at dental schools or in any educational setting, and we all process stress differently. My way to de-stress myself is walking in the nature, reading books, listening to music, and communicating with my friends. I think so. It was very important that I gave a different perspective to this and not just said, oh, I just do meditation or I just watch TV. I'm talking about books, which means, yeah, I am a person who reads books besides dentistry. So I was talking about me being an avid learner. I talked about my last book that I read, what it taught me. Then I talk about being in the nature. That gives me a sense of connection with the nature and my ability to de-stress myself by being in an environment that is clean, be able to breathe fresh air, and it gives me a time to talk to myself when I'm in the nature all by myself. Then communicating with friends. I understand you may not have friends immediately. communicating with friends is very important because then it helps you understand what others are going through. Sometimes you want to help them, sometimes they will help you. So this all answer was encircling different strengths in my application, meaning I am a team player. I have a life outside dental school. I am an avid learner because I learn to read books. I like to connect with the nature. That is how I de-stress myself. So you can use anything. You can say, I go to the gym to de-stress myself after a long day at a dental school because although it is stressful, I'm also working on my body at the same time, and that gives me pleasure. Or you can say, I do crocheting because that helps my eye to hand coordination. It not only is useful in dentistry, but it also helps me calm down. So you can answer whatever you want, but don't be fake. If you're not playing rugby, don't say I play rugby. Like, don't lie.
I just had one important question. Like in last 1 hour of the talk what we had, what I realized is your command on your the word selection, the way you speak is really really different. And when you speak, I can sense that you do have great communication skill. I really want to know whether you were like this before when you were undergraduate student, or is this the quality what you have developed over a period of time?
So honestly speaking, first of all, let me thank you for a great compliment. That's a very nice and kind of you to give me a good compliment on my communication skills. Uh, Going back in dental school, I had good or decent enough communication skills. As I said, I have been a follower of my grandfather's rule that, once a student, always a student. After I came to the United States, my first job was working as a survey research assistant at a survey research office in the University of Illinois Springfield. So in this job, we were supposed to call random numbers on telephone and ask them interview questions for different projects that were state funded. And it was very important to get the number of surveys by the end of the day, a minimum number, otherwise, they would not keep your job going. So I think so. It was very crucial for me at that point to make sure that I had that job during my summer, during public health, during my summer semester. So I started working on my English. I started watching a lot of news channel, understanding the pronunciations. I started reading a lot of news. And most importantly, I started communicating with my friends. I started reading phrases. I started understanding the culture. I started reading how different words fit in. I'm an avid learner. Like even today, I talk to a lot of my friends and they will use certain phrases. And I will ask them, what is the meaning of this? Like when I first came to the United States, we had Bud Price, who was our office manager for the public health, an elderly gentleman who had such a plethora of knowledge and different phrases that he used that I was like impressed. And it gave me the more desire to learn more about the culture, the different use of words. The words that we use in India are not very commonly used in the United States. They have a word, maybe we just don't use it for every little thing. And I think so, talking to my American friends, as I said, my friend Richard, there's another friend, his name is John Callahan. These people are like, have been a great source of inspiration. They will tell me what word to use, where to use. So that has really helped me grow as a person. But I think so, there's a deep desire to learn. Like every single time, if I read something and a word comes up, I will Google it, try to understand what setting it is used to, and try to incorporate that in my daily language usage. And that really helps my vocabulary grow and kind of makes me more confident communicating with other people.
Okay. I don't know. I find it very difficult, especially we have been shouting whole day, sometimes on the student here, there. Is the life, you did mention that you wanted a work-life balance, and that is why one of the goal of going abroad was also to have a work-life balance. Do you really feel we lack work-life balance in India?
To be honest, the reason for work life balance is very important, no matter where you are, whether you are in India or in the United States. And the whole idea of that you will have a work life balance in the United States and not India is a misnomer. I think so. For me, the reason for the United States was my passion and dream to come to the United States. But equally important for me was to learn my mistakes that I was doing as a practitioner in India. So the biggest issue that I faced was I had a practice in a rural town. where it was walk-in clinics. I was never giving appointments. I would start my clinic at 8:30 in the morning and would run until 10, 11 o'clock at night. And I worked 365 days in a year. So there is something called as a burnout syndrome. And I definitely was burned out. I had no time for myself or my family or the things that I like to do, which include reading, music, or going out with my friends. The time was very limited. This was the most common issue that we all face in India because a lot of people practice in smaller places where we have patients who can just walk in and you have to treat them. So it is very important to have work-life balance in terms of how much time do you divide for your work, your family, and for yourself. I always quote an example of one of the triangles that's a part of psychology, which says we put our work at the topmost priority, family second, and ourselves at the end. So when you invert this triangle, when you make yourself the priority, if you're happy, your family is going to be happy. If everything in your family is happy, you'll be happy at work. And if at work you are happy, then the quality of the treatment that you deliver or the way you interact with your patients matters. So I think so the most important thing is to balance out between how much work you want to do, how much do you prioritize your life and the family and the friends that are around you. Unfortunately, we are so money driven and so career driven and ambitious that we tend to forget ourselves. We are the last priority. Also, sometimes we are driven by insecurity. It took me a long time to accept the fact that I did suffer from insecurities. We're always worried if we're going to lose our patients. We're always concerned if our patients are going to go to somebody else. These are some of the insecurities which are obvious in some people and which are underlying subconsciously. So the reason you don't take a day off from the clinic because you're worried, for example, that you may lose patients. It's okay. You have to value the patients who are your clients for the long period of time rather than worrying about patients who are not willing to wait for you just because you have the clinic closed for that day.
Very true. So since we have covered up pretty much everything, I have a few more questions about the interview. For example, one another question which people do ask is that because there are so many dental schools and you are applying everywhere, or at least maybe two, three different dental schools, and one of the questions which they may ask is that why do you want to do dentistry in our dental school? How do you answer such questions? Because all the schools might ask you the same question, like why do you want to do it here? So how do you give different answers in different dental schools?
I think so. The most important factor that a school wants to know when they ask you this question is have you done the research to the school that you're applying for? And so I have always looked into each individual school when I submitted my application and got an interview from. I would look into what kind of program they have. Is it something that they're offering at their school which provides opportunities to do residency? Do they have a general practitioner residency program? Do they have any advanced care facilities? Do they have any special needs clinic? Do they have opportunities to shadow in operating rooms or have general anesthesia facilities? This is just like more of a structural thing. Then what is about that school that stands out? Then you want to look into the research that the school has had. Their faculty may have some research that you think is very important, and maybe that is something that you would like to do research in their facility if that is something that is available. So it is very critical to understand each individual school. I mean, sometimes the answer can be as simple as, okay, this is a school that is close to my hometown, or I have family around St. Louis. I want to stay in the area and I would love to come back and teach at the schools. I think so. It's very important going as a student to have a good family support system or something like that. But I think so. Mainly, the school is mainly trying to understand, have you gone through their website? Have you taken the effort to understand what are the highlights that the school has had over the period of years in terms of curriculum, teaching, or the accomplishments of their faculty that make you want to go to this dental school or to be a part of it? Sometimes it can also be a thing like where the school participates into like a veterans program or give kids a smile program. These are programs that a lot of schools in the United States do to give service back to the community. So you want to talk about that. You also would benefit if you're trying to do a residency after that dental school. Would say, well, I would love to go to this dental school because it would give me opportunities to shadow some of the residents in the program, and that will provide me a chance to see what residency or specialty I would like to pursue going after once the dental school is over. So you need to research a little bit about the school. Every school will have its like mission statement. Are your principles of philosophies align with the school's mission? So you need to know, you need to research the school a little bit. You can also use the references saying that I know somebody from the school and he has taught me about all the good things of the school. You can talk about like what are the things that are available, like CBCTs, scans are available, and sedation dentistry is available, which are some, not all schools provide that. But you want to talk about the highlights of the schools that make you want to be a part of the school. So this answer has to be tailored according to individual school, and don't give a generic answer because it's not going to stand you out. The school wants to see that you have gone and done your homework before you came for the interview.
Okay. That's quite informative because I think I never thought of answering such questions in this way because it's very difficult, to imagine what can be the answer. But hearing from you, especially when you are conducting interviews, I think you are the best person to guide the students, and the students will be really benefited with this podcast. I really want to thank sir, that Dr. Kapil, for giving me your precious time, and I'm sure that this is like an interview in a dental school where I am on the other side asking you questions, but as you have kept on mentioning from the beginning that you should not fake and you should answer it from your experience and from your heart. And that is what I have realized, that for every question what I have asked you today, you have been very humble and you have answered it from your experience, from your heart. I want to thank you for giving me your time, sir. It was amazing to listen to your journey and your inspiring story.
Well, thank you, sir, for giving me this chance to talk about my journey. I hope I can be supportive and helpful to any of the students who want to pursue education in the United States. And I always think that it's very important, no matter where you go, how far successful you become, to be humble and to have gratitude to all the people who have helped you along the way. I don't think so. This success is something that is like only mine. I think so. All my friends, my mentor, all my friends who I've made in the United States, back in India, family, they are the building blocks of my success. And I don't think so I could have done without anyone more or less of them. And I take this opportunity to thank them with all my heart. And I think so I'm very, truly, truly blessed to have some amazing people that have crossed my path and made me to who I am today. And I also want to thank you for providing this opportunity to share my story. As I said, I'm always available to provide any information to any of the students if they want to talk about it. It could be just a simple talk about dental school, or if they're struggling through anything, more than happy to share, a few tips and tricks or any advice that I can possibly give to help them out in their life. So I want to thank you to